I found out once you've been on medications for 2 or 3 years, food becomes a huge issue. You are in a battle with the medication and the protein in the foods. So what happens is you'll eat, and an hour or two later, you are overcome with I guess paralysis is the best way to describe it. Those are your freezing episodes. There's certain things, dairy products, for sure milk contains all of the amino acids, so, you've got a protein in there, probably tryptophan or tyrosine, that's going to counteract your levodopa. And, you all of a sudden become a statue. So managing that's very difficult to manage because you want to eat, you have to eat, but you have to be cautious about doing it. When you talk about Parkinson's, people don't associate it with pain. But there's pain. It's a nagging annoyance, because it's a different kind of pain. You can have nerve pain, you can have muscle cramps, you can feel all these different types of pain that you can't explain, and they're there, but you get used to it. And a lot of the pain comes from the dyskinesias from taking Cinnamon. It's just a fact of life. So you have to deal with it. And Cinnamon is still the first course of treatment. So you can't just cut it out. And I've had doctors try to prescribe me different medications, dopamine agonists and CLMT inhibitors, MAO inhibitors, and all that. And I researched the stuff carefully before I accept it, and I've turned down pretty much everything. I take Cinnamon, I take amantadine, and I take biperitin. And it's a tricky game to get it balanced, and you can get you some functional time throughout the day if you need to do something like go to the store, which is always carefully planned. But I take about 6 or 7 pills a day total. The doctor's recommendation is about 30 pills per day, and I've tried to follow what they have prescribed me, but quite frankly, it doesn't work. It just makes you miserable. So the less medication you can take, the better. Another thing you learn to deal with is that when you go out in public, you can try and time it just right. And right now I'm pretty good. I have advanced Parkinson's disease, and the movement disorder. If I'm not taking my medication, I'm not taking it right, I'm not doing anything. So when you go out in public, you're mindful. People are looking at you, and there's different kinds of people. Some people look at you and just give you the impression of what is wrong with that guy, and other people look at you with sympathy and pity, and I don't want either one of those. When someone's looking at me, and I know they are, and they're wondering what my deal is, I will just walk up to them and tell them I have Parkinson's disease. So when you do that, they tend to be a lot more comfortable with you, because they're afraid to ask. It's embarrassing for them, because you've got somebody dancing in front of a check stand at Walmart, and it's your medication, and people don't understand that. You discover accidentally, by the way, because again you're rarely warned of it, that food is a difficulty for you. And what happens is that when you consume certain proteins, it directly counteracts your levodopa. So that ends up in freezing mode or inability to initiate movement. And you're back at that frustrating point. So you have to plan your meals carefully, what you eat, when you eat, how you eat. I see people that they're not dosing their medication correctly. And it's wreaking havoc on their life. When it comes to treating it, I figured out a long time ago, if you want to treat your Parkinson's, you're almost better off treating it yourself. I've seen over 40 doctors in several different countries, and it's the same thing over and over again. There's not a lot they can do. They can try and follow protocol. They can suggest different drugs to you. But you need to get a second opinion and a third opinion and a fourth if necessary. I've been prescribed drugs, and I've gone to different doctors and asked them about them and told them what I read were the side effects of them. And most of the time the other doctors will tell you that you shouldn't take that. I wouldn't take it either. Take as little medication as you can. But you have a lot of doctors that want you to take as much medication as you can.